So we'll do sterile dressing changes and learn how to put on sterile gloves today. We'll remove your old dressing, assess the wound like you would for any wound, assess and measure it. If you tape on this, it should just be on the dressing itself. Nursing is really tough. It's a really tough job. It's a very rewarding job, but it's tough. Nursing school is hard, there's no doubt about that. And so the students have each other to fall back on. They become best friends with the people that they go to nursing school with.
Between the faculty and my fellow students, there's a real camaraderie. When you're going through something so hard together, you really do make deep friendships because you're all just supporting each other, and we really do support each other.
You have to dedicate every day, basically from when you wake up to when you go to sleep, studying, you're listening to lectures, you're rewriting notes, all of it. But everybody here is so genuine. All the professors want you to thrive. They want you to pass the test. They want you to pass the boards. And having that type of surrounding and that type of support is, honestly, I couldn't do without it.
9 credits per nursing course alone. It's a heavy load. But the person that's successful is someone that really wants it, that really wants to be a nurse.
This is one of the most difficult things I've ever done, but it is worth it. It is a lot of work and it's a lot of time and dedication. But if you're willing to put in that time and dedication, this is a program that will prepare you for anything in the future. And you will always have the resources you need here to succeed and achieve your goals.
This program will make it happen for you. I worked full-time during nursing school. It was very challenging. I was an ER tech at the Elliott and I worked full-time throughout the whole nursing program. And the staff here, the clinical instructors, they just want you to succeed.
The whole thing of nursing is a calling. It has to be a passion. You have to love it because it's hard work. And when you graduate, you're going to be dealing with people who are coming to you on their worst days. And you have to help them to be supported by being caring and compassionate even at their worst moment. If you're someone that is doing it for a paycheck, you're not going to be able to meet those needs.
It's a lot to learn to take care of somebody's life, right? We have a lot of, you need critical thinking. You have to be really cognizant of what's going on with someone. It's not just the skills. It's about using your brain and thinking about how to put all of these things together so we know what our patients need. We're the eyes and ears for the doctors at the hospital.
If you have the dedication and the discipline, it is 100% worth it, especially at the cost. You're not leaving here with 60 grand in debt. That's the biggest thing. And we have more clinical hours than I think any of the other nursing programs that I've heard.
Going through the whole program, it may be tough, it may be a lot of work, you're learning a ton of information, but you're going to have years of being able to put that into practice and seeing yourself making a difference in people's lives every day in the hospital.